everybody, and welcome to our first get together on Perspectives, the home edition. First time we've been back together since Christmas. I hope you had a good Christmas. Hope you were able to get together with family and friends and really truly enjoy it and eat too much and open a lot of presents and just laugh yourself silly. Anyway, today, our get together, we of course going to have two segments. First segment, she's already in place and she's raring to go. Her name is Terry Hadley Ospach. I hope I did that right, Terry.
Yes, it's Ospaw, but that's fine.
Ospaw, okay. My bad. When your name's Sam Jones, you have trouble with names. Anyway, Eastern Oklahoma Donated Dental Services. Tell me about your organization.
Well, EODDS was organized in 2003, and it took place with the help of 3 local dentists and some nonprofit organizations. Tulsa Area United Way, George Kaiser Family Foundation, and Delta Dental of Oklahoma are 3 of the big providers. Mm-hmm. And the organization basically takes care of the elderly and the indigent population, providing the dental health care that they cannot otherwise afford on their own.
And it is desperately needed out there, is it not?
Yes, yes. Everyone's dental health definitely affects every other part of their body, and people don't really understand that. It's not about cosmetics, it's about the overall health, and that's what we're there to do, is to help people to meet their needs in that area.
And if anybody knows anything at all about health and well-being, they should know that if your teeth or gums are in good shape, then the rest of your body is going to follow suit.
Yes, very much so. It is definitely connected to everything from cancer. Oh, goodness. A lot of our patients that we have, we receive through kidney dialysis centers, because these patients need to have dental clearance in order to be able to be a transplant eligible. So a lot of these people cannot even have certain surgeries without passing dental screenings. Mm-hmm. So.
Well, let's talk a little bit about you. I know very little about you. I went to your website, didn't tell me much, but so where do you come from?
I actually was born and raised in Nowata, and I live there now. And I went to dental assisting school in the early 90s. From there, I went to work in the dental office, in chairside, office manager. Then I wrote the curriculum for a dental assisting program, and then ended up in nonprofit.
And it seems to me, just an observer on the outside, it's a perfect fit.
Oh, yes, yes. Without this program, actually there are, on an average, our local dentists, and I say local because we work with within 26 counties of Oklahoma. We've had over 400 dentists since 2003 participate in this, and the dentists provide the dental care in their private practices. So the patients go just like you and I would go as a paying patient. And so no one knows any different.
Well, tell me this, who was it that was looking around out there and one day and decided, you know what, we need to put something together for folks that can't do it themselves?
Well, actually, it started originally with a program called DDENT that is still working in the Oklahoma City area. Mm-hmm. And then they decided that they could not take care of Eastern Oklahoma. So the women that were working through DDENT program at that time said, hey, we can't let this go. So they went before Tulsa County Dental Society, and they've got some dentists on board that helped push it through, and filed for the 501c3 and just worked it up. And like I said, George Kaiser was one of the first big contributors and has been a part of it ever since. And most of the funding comes from the Tulsa area, because Tulsa is just a very giving, loving community. Mm-hmm. And like I said, 26 counties that actually participate in this part of it.
Well, it's good to have George Kaiser Foundation on your team.
Yes, it is.
especially in a project as demanding as this.
Yes.
Do you have any numbers you can share with us? How many people you've helped?
Yes. Before COVID, on an average, our doctors were donating to just over 2,000 people a year. And it came out to over $5 million worth of dental work a year.
My word.
Yes. I mean, and we are the largest, most giving, I mean, nationwide, whenever you go and get the numbers. And our doctors, they're able to earn what they call continued education credits. They can get up to 10 per reporting period, which is every 3 years. And I think they just changed that to every 2 now. But the doctors get paid nothing, absolutely nothing. And then they pay their staff to work on these patients. And so this money, you know, is money that they could be bringing in, but instead they're giving it to people that can't afford this work. And any money that goes out of our organization goes to pay for lab fees, which our labs also do at a discounted rate. And so
I know our church, Boston Avenue Methodist, has also been a contributor. And we receive reports from time to time about all of the good you guys are doing. And I mean, it's phenomenal.
It is. Our doctors are so giving. I mean, there's no words to describe how thankful these people are, and to see how it does change their life. Everything, like you said, from the medical side of it, just to the spirit of everyday living, to be able to do the things that they would not do before. So, some people feel like dentistry is a luxury, and it can be, and it is, but you really need it in order to be healthy all the way around.
Do you also involve children as well?
Our program doesn't take care of the kids so much because of the Sooner Care program and children that they qualify for Sooner Care. So that's why this program was initially started, was because the elderly, it was really about the elderly right out the gate, about making sure that these people had their dentures, had their partials, didn't have toothaches, because they didn't have a means to pay for it. Now, I'm not saying that we won't help, because there are cases that a dentist will contact us and say, I have a family that just needs your help. And if they want to help them, then we do what we need to do to make it happen. So
if I were to pin my ears back here and say, well, you guys are cutting a wide swath through a very needing area, would I be on target?
Yes. Our biggest need, to be honest, is more volunteers. And we feel like, and our contributors feel like, this is the best way to handle it, is by letting the doctors do this in their office rather than having a clinic, a free clinic where people have to go sit all day. This way the doctors can do it in the privacy of their office, where they have their instruments, their chairs, their staff, you know, during their business hours, and don't have to leave home at night and things like that. But yes, there is a definite need, and we could do so much more if we just had more volunteers. And again, we don't ask them to volunteer a certain amount of hours or a certain amount of money, because they don't actually just, you know, they don't give out money, but their time, and it's so precious, their time. But we have some doctors that they'll ask the question, what more can I do? What more can I do? I'm just one person. But what they could do is to ask other doctors to participate, because
it's an area that most folks think, they just don't think about the need.
Right.
It's out there.
Yes. And we have people, I mean, that call, you know, every day needing an application. And that's the way people can go on our website and download an application, or they can call the office, we'll mail them one. But, you know, we don't have really an emergency service. We try, if it is an emergency, to reach someone to get them taken care of as soon as possible. But like I said, the more people that help, the less it is, you know, on everybody. So we're not spread so thin. But we have patients that call that are just thankful that they can get the help of getting an extraction because they're having a toothache. But when they find out that then we will turn around and replace that tooth with a partial or dentures, then, you know, you see tears of joy. People that's come in there with cancer, they have to have their teeth removed because they're in such bad shape. But then to know that we're not going to let them go toothless, you know.
I would venture that some of those folks are in such need that that it's affected other areas of their body.
Oh, most definitely. Yes.
And
Yeah.
when they recognize that and they know they can't afford to go out,
Mhm.
and this certainly fills a major bill.
Oh, yes.
Uh,
Yes.
I mean, it's like a godsend for them.
Oh, yeah. We are just so thankful. If anything, I mean, like you said, where something seems to fall down, then somebody else comes and fills the gap and picks it up and goes on. And so the organization has been so blessed. And like I said, we can't thank the people in Tulsa enough, the doctors and the funders, because they do recognize that there is a need. And yes, Sooner Care just changed their policy. So we're helping people to find a way to let them know, hey, if you don't have Sooner Care, then this is how you go about finding out if you do qualify. But because Oklahoma didn't used to cover a lot of areas, they just did extractions. But
Yeah,
now,
and there have been probably a lot of folks out there who need your care
mhm.
and aren't aware of it yet. Let me
Yeah.
ask you about that. We've got about a minute and a half, and
Mhm.
I'm so sorry we're not going to have
That's
more
okay.
time than that. But let's say there's someone out there, a doctor, that wants to get involved, or let's say there's someone who wants to contribute financially. How do
Mhm.
they go about it?
You can do either of those things by going to our website, which is eodds.org, or they can call our office and we can help them in that way. But they can do either one, or even someone that needs to get an application, they can do that online as well, or call our office at 918-742-5544.
God bless you for putting that out there. I know Emily, our director, producer, and control room, will get that on the screen for us a little bit later, and we'll have that up. Want to thank you for taking time to visit with us. And we got maybe 30 seconds. What do you need most right now?
Right now, our biggest need is doctors to volunteer, honestly. If anybody can volunteer their time, give us a call. And again, we'll set you up with the patient yesterday.
That's a wonderful, wonderful way to go about it too, and a service to mankind. Give back, if you will.
Oh, please.
Listen, Terry, thank you so much for taking time to visit with us, and hopefully we'll talk to you again down the road. All right.
Yes. Thank you very much for having us.
Okay, Terry. Bye-bye.
Bye-bye.
We're going to take a short break, folks. When we come back, we're going to take you to a section of the country devastated by the most incredible tornado you've ever seen, for a follow-up report. We'll be back with, and there's a local angle to this. We'll be back with more right after this.